industry partners are in the room today, and I want to give a special shout out to Compass and Johnson & Johnson and Myriad Genetics, Neurocrine Biosciences, Otsuka, Pfizer, Sage Biogen, the Takeda Lundbeck Alliance, and Teva. And we really appreciate their support. They help make the work of the Regional Policy Council possible. We also have in the room today our amazing Regional Policy Council representatives. These are 4 of MHA's most outstanding policy people. They're in the room. Laura Evans is up here. Wave, Laura. Barb Johnston. Ben Harrington in the back. And at the table, too, with Ben is Shauna Movahill. So any questions that you might have, they are here to answer, and you'll be hearing from them later. Today's meeting, Ripples from the Rain, Trauma, Visible and Invisible, is a deep dive into some really difficult subjects. If something that we talk about today makes you uncomfortable, please feel free to step away. Or if anybody needs some extra support, Alicia Coffey, who's up here, is a certified peer specialist, and Alicia will be very happy to assist you. And we're just really thrilled that you're going to be here and that you're going to help us begin by celebrating some outstanding legislators. I have one more piece of business. There are 10 cards on your table. America, would you hold up those 10 cards for us? There we go. And one of them, if you scan it, will take you right to the agenda, so you can see everything that's coming up. I won't go through the agenda because you can all take a look and see the agenda. And the other one is a survey that we would very much appreciate your input on. Most of you in the room know about Mental Health America's report that we put out every year, the State of Mental Health in America. And what it does is it looks at national data sets and it helps rank who has the most access, because Regional Policy Council has a middle name, it's access. Who has the most access to the services and supports they need by state? But we're looking to know more of what you'd like to see in the report. So if you wouldn't mind scanning that code as well and taking the survey and giving our research team that puts together the report your feedback, that would be very, very much appreciated. Anyway, let's get to the important business of the day, which is thanking legislators. You know, we spend a lot of time, all of us in this room, visiting legislative offices. And usually we go in to complain about something, ask for something. But what we do here this morning is we say thank you. We love to essentially catch legislators being wonderful champions for mental health and substance use disorder conditions. So we're going to get started with, can I invite Kay Denault up here from our, oh, there you are, Kay, from our MHA of Mississippi, and she has a very special award to present in person. Come on up, Kay. And I'm going to step out of the way.
I'm here to introduce Representative Samuel Creekmore from Mississippi. And he's done a lot of things for our state. He came in 2020 and of course has been on several committees and been working hard. But I think one of the bills that I'm most excited about is House Bill 1640, which passed this year. He introduced the bill. What's important about this is our commitment process in Mississippi, and I'm sure several of your states are the same way. A lot of times people are in jail before they get their treatment that they need or they move on to different entities. And so what this bill does, it makes sure that people are getting their examinations, the screenings, if they need treatment, all of that happens first before those hearings and those affidavits for commitment start to happen. So it can shorten that process down, excuse me, from 10 days to even just 3 days. There's a lot of reporting that has to happen to different entities, like the Sheriff's Department, Mississippi Department of Mental Health, and our counties are responsible for that treatment that people are getting in those examinations and things, so that helps our state. So it helps to keep jails from being the facility that holds people, and it also, the clerks, the people who are working in the courts, they receive a lot of training to be able to know better what is happening with people when they're coming into those situations. And it's just, overall, it's more humane. So we thank you for that and all the other work. Come on up. Thank you. Let's see. One of these is for you, but I'm not sure.
No, I think they mailed it. Thank you. Good morning, everyone. I'm deeply honored to accept the Mental Health America 2024 Legislative Champion Award. To be recognized by such a distinguished organization, which has tirelessly advocated for mental health for decades, is truly humbling. I would like to express my heartfelt gratitude to Kay Denault. Thank you for this nomination. Kay's dedication to improving mental health in our state and access and awareness is an inspiration. And her belief in me is truly humbling, and I can't say enough about what it means to me. As you all know, it takes a team to pass a bill. It takes effort from lawyers in the Capitol. It takes a lot of work from Democrats, Republicans working together. And as a legislator and chairman of public health, I'm privileged to work alongside many passionate individuals, one being a business partner of mine, Frank Dodds, who's standing in the back. Frank's been in the mental health profession in North Mississippi for over 30 years and has helped me tremendously. Thank you, Frank. It also takes passionate organizations such as Mental Health America, committed to addressing the mental health challenges in our communities. This work is not just professional, it's personal. We all know someone who struggled in public and in silence, and it's our responsibility to ensure that they have the resources, support, and dignity they deserve. This recognition fuels my commitment to continue advocating for policies that expand access to care, reduce stigma, and support mental well-being for Mississippians and beyond. Thank you to Mental Health America again for this tremendous honor and for leading the charge in this vital mission. I accept this award not as an endpoint, but as a reminder to keep pushing forward for those who rely on us to make their voices heard. I'll leave you with this. Let us not grow weary in doing good, for in due season we will reap if we do not give up. Galatians 6:9. Thank you very much.
Thank you, Kay, and congratulations. Representative Creekmore, we're so glad that you could be here today with us in person. It's now my pleasure to introduce Dr. Janine Listinsky from Mental Health Partnerships. And I gotta share a little bit something special about Mental Health Partnerships, which used to be known as the Mental Health Association of Southeastern Pennsylvania, which was where I got my start, my home base. It will always hold a very special place in my heart. Alicia also, that was her home base, and we're so thrilled that Janine is executive director there now. We're thrilled. And she is going to present an award. Now, Unfortunately, Senator Vincent Hughes could not be here with us in person, but I've been trying to catch Senator Hughes for years, and Janine got him to say yes, so please.
Thanks, Debbie. It's so great to be here together again. This is really edifying for me to be part of such a great group of leaders here. And to be standing here to have the privilege to honor Senator Vincent Hughes, who I've worked with for decades now. He's a distinguished advocate for mental health with steadfast dedication that spanned decades of service and impact in Pennsylvania. He exemplifies our shared mission of Mental Health America and mental health partnerships to advance mental wellness, dismantle barriers to care, and foster supportive communities. He's a passionate voice for mental health awareness. In fact, he's leveraged his platform, a regular radio show, to destigmatize mental health throughout the state. The show provided critical education on topics such as suicide prevention, stigma reduction, and access to mental health services. In addition, of course, he has led numerous legislative efforts to benefit people experiencing mental health challenges, and he continues to be a champion in Pennsylvania, and we need him now more than ever. By honoring Senator Hughes with this award, we're celebrating his unwavering commitment to advancing mental health policies and leadership in promoting community well-being. His contributions indeed resonate deeply with both MHA and MHP, our mission and all of your mission, making him a senator to celebrate. I present Senator Vincent Hughes.
Hey, State Senator Vincent Hughes here. I want to thank the national organization Mental Health America for this honor, this award, Legislator of the Year. Really do appreciate it, but I just want to kind of change it up a little bit. We've been doing this work around breaking down the stigma and driving more resources into behavioral health and mental health spaces for a long time. And I've come to learn and meet legislators all across the country who've been doing this work for a long time. So I'll receive this award for me personally, but understand this, I'm receiving this for hundreds of legislators all across the country, hundreds of local elected officials, county commissioners, city council people, mayors of big cities and small towns. I'm receiving it on behalf of them because they've been working hard in a space that for far too long was not a popular space to work in. But we've broken down the stigma. We've broken down the barriers. We made it okay to have public conversations around accessing mental health services. We made it okay for people to admit they need counseling. The next level of work that we have to do is expand the services and make sure that there's more providers in place to provide the help to people who desperately need the help. We can no longer be in a situation where folks have to wait months. Once they recognize they need help, they have to wait months before they actually get it. That's the next charge. So thank you for this honor. Thank you for this award. I truly, truly appreciate it. Know that I'm receiving it on behalf of hundreds, if not thousands, of elected officials who've been doing this work unnoticed for so many years and have had the success to break down the stigma and understand this. In this new world reality that we're in right now, where there's threats to Medicaid, threats to Medicare, threats to the Affordable Care Act, where prescription drugs will likely go up, the cost will likely go up. We need to do more of this. Be much more public advocates to make sure that we make a difference for the people who desperately need a voice to stand for them. Thank you.
Janine, and congratulations to Senator Hughes. Now, I can't help being a little biased, as I mentioned, towards Philadelphia, and I can't hide the fact that that's where I'm from, even though I live in Colorado now, because if I told you I was going to go get a drink of water, you'd know exactly whence I have come. So it is my pleasure to present another wonderful Pennsylvanian, Laurie Barnett Levine, who is Executive Director of MHA in southwestern Pennsylvania. And she's going to present an award to Representative Eric Nelson, who I've had the pleasure to meet many times but was unable to be here with us today. And Laurie's going to tell us a lot about the fabulous work that he has done.
We have to make sure that both sides of the state are adequately represented. So I'm really happy to be able to present and was happy to nominate Pennsylvania State Representative Eric Nelson for this award. Representative Nelson and I have had years to invest in our professional relationship. So it took us a long time. We were virtual strangers when I was first introduced to him by a mutual friend. We knew that we don't always agree or share the same perspectives, but that's what makes the relationship all the more special. What we do have is mutual respect and a willingness to talk to and listen to each other. I know that we have each learned from each other. Representative Nelson knows that he can call on me anytime, and he does. He is there when I need him as well. I can tell you different things about him. The important things are that he's a really good person. He's a veteran with distinguished honors. He volunteers on missions with his church. He's a strong conservative, and he puts his constituents first. He lives on a farm, and he has 7 children. Though we don't always see eye to eye or see things the same way, I have told him that it's the person, not the party, and his support for mental health. He has even texted me during legislative meetings to ask me questions, and I'm there to answer him. He walks the talk. Even though he can't be here today, he actually called me last night to thank me for nominating him for this award. Who does that? Representative Nelson does that, and that's why I nominated him. Thank you.
Hello, everyone. Man, I wish I was down there in New Orleans with you versus being up here in cold Pennsylvania. I just wanted to say thank you so much to Mental Health America and the Regional Policy Council. It's an honor to receive this award. But more importantly, the great work that you do in helping to support and strengthen the lives of individuals who are struggling with mental health conditions or substance use disorder. Thank you for the work that you do. It's an honor to be in this fight together. I have to do a special shout out to my friend Laurie Barnett Levine. You know, it was years ago when I first called Laurie about a situation. And I said, Laurie, could this really be happening? You know, and together we have expanded the net, brought more people onto the coalition, and helped to craft both funding wins and policy wins here in Pennsylvania. So keep up the good work. I'm here with you, and let's keep it moving.
Well, you're just getting a little taste of why we love to say thank you, because there's so many wonderful legislators across the country. We're going to learn about some more. We're going to meet some more right now. And I'm so thrilled to be able to ask to come up MHA's wonderful volunteer general counsel, the man behind our public policy committee for many years, and my good friend Mark Hireman from MHA of Illinois.
Thanks, Debbie. So, Mental Health America of Illinois is pleased to nominate 2 people from Illinois as champions. And while each of these legislators have done wonderful things over the years, there's a reason we're nominating them both in 2024 is they were instrumental in passing a very important bill improving network adequacy for health insurance, private health insurance, and Medicaid. So this bill, which is known as the Healthcare Protection Act, was sponsored in the House by Representative Muller, who is here today, and was sponsored in the Senate by Senator Peters, who will be appearing virtually. Before I say any more about the 2 wonderful champions, I would like to just say a few words about the bill, because the bill is so important to everyone in Illinois, certainly everyone who has a mental health condition or cares about people with mental illnesses. So one of the biggest roadblocks and obstacles for people with mental health conditions has been that private health insurance and often Medicaid do not have adequate networks of care for people. That is, they don't have enough providers, they don't keep track of the providers, people can't find the providers, and there are other roadblocks. The Healthcare Protection Act greatly removes those barriers, strengthens the ability of people to actually take advantage of their health insurance, to get to an actual provider. It's wonderful to have health insurance, but if you can't find a provider that your health insurance pays for, it's of no use to you. So the bill is hundreds of pages, so you don't want to hear me talk about it. But I'll just say a few of the highlights of what it did. 1, it requires evidence that the plan includes essential community providers. It strengthens the rules governing the ratio of behavioral health providers to persons insured. It strengthens the requirements concerning appointment time, wait time, length of driving that you have to go. Illinois is a big state, more than 300 miles long, and they're often very difficult to get to a provider who's actually in your network. If your network is inadequate, then an out-of-network provider you cannot be charged more for an out-of-network provider than for an in-network provider. So, and it also prevents prior authorizations in Medicaid for access to inpatient psychiatric care. With all of those changes, we owe that to Representative Muller and Senator Peters. Representative Muller, who is here today, has served in the Illinois House for more than 10 years. She serves on numerous committees, but most importantly, she is chair of the Human Services Committee and is vice chair of the Human Services Appropriations Committee. And of course, that's where all the money comes from. And we know that Representative Muller is there to make sure that mental health services get their fair share. So I'm very pleased to have Representative Muller here today. And thank you so much for coming, and we're happy to have you as our champion. Thank you so much.
It's quite an honor. Thank you. I wasn't sure if the senator was going to go first. I don't know how it is in your states, but there's a little rivalry between the House and Senate, and usually we get upstaged by the Senate. But truly, it is such an honor to be recognized by Mental Health America and Mental Health Illinois. Thank you, Mark, for nominating me and Senator Peters for this award. The Healthcare Protection Act was truly a labor of love that started in the governor's office. I have to give credit where credit is due. Governor Pritzker made this a legislative priority very early on last session, and I was honored to be asked to carry the bill in the House and work with Senator Peters in the Senate. As Mark mentioned, this bill is going to be transformative in Illinois in making sure that we are putting patient care above insurance industry profits. And that was the main message that we sent during the legislative discussion and as we were moving the bill through the House and Senate. We heard from patients all over Illinois who had had horrendous experiences trying to access care because of policies that are put in place by insurance industry, whether it's step therapy or prior authorization for accessing emergency mental health care when showing up at a hospital. We heard from doctors and physicians who want to provide the best care for their patients, but because of insurance industry regulations, felt that they couldn't. So we were happy to get this bill through. We thought it was going to be a bigger battle than it was, but it ended up getting bipartisan support, which I think sends a good message to other states around the country and even to our federal government that this is a nonpartisan issue. People are demanding better access to health care, and in particular, mental health care. And I hope that the success that we had in Illinois translates to other places, because clearly this is a system that is broken and needs to be fixed. And very hopeful that we can move this on a national level. Personally, I just want to thank you for all the work that you do. I know that mental health and addiction touches so many lives. It's touched my family's life in many different ways. My mother struggled with addiction for most of her life. She actually lived here in New Orleans for most of her life. I was raised by my grandparents in Illinois because of her struggles with addiction. And I wish that, back in the 70s and 80s, there had been as strong a network and destigmatization, as we just heard from the senator from Pennsylvania. She could have gotten the help that she needed. And so from the bottom of my heart, thank you for the work that you do as individuals, as an organization, on behalf of the national and at the state level. You're truly changing people's lives and improving our country with your dedication. And I'm here to do what I can to support you and make sure that we are improving people's lives moving forward. So thank you again.
You get to be in a picture with me. Thank you so much. Thank you, Representative. So Senator Peters, I believe, is in Europe and isn't going to be here. I think the weather's quite fine here as someone from Chicago, but apparently he thinks otherwise. Senator Peters has been served in the Senate for 5 years. He represents the district that I used to work in around Hyde Park on the south side of Chicago in the University of Chicago. And Senator Peters, in addition to doing this work to get this wonderful bill passed, has a long reputation for criminal justice reform in ways that is very important to people with mental health conditions. So Illinois, with his leadership, came to be the first state on a statewide basis to abolish cash bail. And that has worked quite well in Illinois and has dramatically reduced the number of people who are in our county jails, including the number of people, of course, with mental health conditions who are in county jails, still too large a number. So with that, I will just say we're going to hear from Senator Peters virtually.
Hello, Mental Health America. I just want to say thank you so much for giving me this award as a legislative champion. One of the things I care deeply about is making sure that we have adequate and good mental health services for people. And one of the key parts of the Healthcare Protection Act was making sure that someone who needed to be in a hospital setting for mental health treatment, that they got it without having to worry about being rejected and turned around. I want people to know that during a time of crisis, that folks are out there looking out for them. I know this personally in my own family. I know this personally when it comes to friends. And I know how important it is in a time where people feel deeply alienated, where they need as much help and support as possible. So thank you so much for the work that you do. Thank you for this award. And thank you for being in this fight. And so I'm excited for what we're going to do next. And I know that we'll be able to do this side by side with each other.
See, I wasn't kidding about Access being our middle name, and we truly appreciate the amazing work, and we're not done yet hearing from wonderful legislators. It is really my pleasure to introduce Melissa Silva, who is the, let me make sure I get your title right, CEO? See, some folks are CEOs, some are executive directors. I can never keep them straight. Of the Mental Health Association in Louisiana. Did I get that one right? See, okay. Because as you all may or may not know, we have now, is it 144, 145 VAL affiliates across the country? And we love them all. And we all used to be called Mental Health Association of, and then we changed our name to Mental Health America of. And now we've got all kinds of interesting names like Mental Health Partnerships and Mental Health Connecticut. Luis, are you in the room? But we are all family, and we're so thrilled. And Melissa, we could not be doing this meeting here today in Louisiana without your amazing help and getting many local folks here to join us and officials from the state of Louisiana, and you'll hear from one of them a little bit later. And Melissa's going to start with one of her fabulous legislators who's here in the room, and we have another one stuck in traffic. So we'll get him when he gets here. Please, Melissa.
Thank you, Debbie.
You're welcome.
We are so happy to be here today and to nominate Senator Beth Mizell. Senator Mizell serves as a state senator for District 12. Representing a very rural area, Senator Mizell is a tireless advocate for the 67% of Louisianans who live in rural communities with access to care being a prominent issue. Her experience as a CAXA volunteer, a business owner, and a mother-grandmother has been major influences in her career as a legislator. Example of legislation that Senator Mizell has sponsored over the last couple years includes Senate Bill 349, which required in-person trauma-informed training for law enforcement officers. Senate Bill 124, creating the Sexual Assault Victims Bill of Rights. Senate Bill 170, providing for parish overdose review panels. Putting 988 on all student IDs in public schools, and most importantly, her wonderful work on maternal mental health. We are so proud to work with Senator Mizell and the Louisiana Rural Mental Health Coalition to bring resources and programming to rural Louisiana. Thank you, Senator Mizell, for making life better for Louisiana citizens.
Thank you so much to the Mental Health of America, but thank you for being in Louisiana. Thank you for your voice. It's so hard to walk into a committee room with a piece of legislation when you know you have to convince it and you think you're the only voice with the message. So you all serve an incredible role in laying that foundation so that we can build legislation on that. I just want to thank you for that. It's hard. It's like listening to your own eulogy when you're hearing. I live in a rural area. It's a lot of poverty. Part of my district is very wealthy. And I tell the legislators from that part of my area, please drive 20 miles and see what rural Louisiana looks like. Not a country club place. It's not there's no five-star restaurants. It's mostly fried catfish. So it's a different environment. It's very important that we look at that unpleasant part of the population if we're going to change quality of life outcomes for our families, for our children. I was a CASA a long time before I became a legislator, and it did color my thinking because you see parents who want to be good parents. You see children who want to be with their mom and dad, and we're not providing the services they need for that to work for both sides. And I think it's just really important that even we get the message to law enforcement. I know I've got a new sheriff, and if I could just share this with you. I'm so thankful. He sees that so many people he's got incarcerated are not criminals. They're not getting the mental health services they need, and that is a shortcoming that if you first have to recognize it and acknowledge it, and then you can put a value on making sure those services are there. We're working really hard to be smart fiscally with how we create and where we place the services, as well as making sure that their transportation is there, that we can connect the dots to change those outcomes. So I really, Melissa, I thank you so much for the recognition. It's, you got to feel a burden. And I do feel a burden. And I think most of the legislators here, you feel that burden, but that starts with the individual. And then to convince the establishment to see that is where you all have been incredible. And I just want to thank y'all for the opportunity. It's great to be here, and I thank y'all for being in Louisiana. Thank you.
Come over here and get that. Thank you. Oh, I didn't put the clicker there. I get your award. There you go. This is a really important part, the picture. And we love it when the legislators put their picture in their newsletters that go out to their constituents and send us a copy, because we like to put it in our national newsletter too. Thank you so much. Truly amazing. As we've been hearing from the legislators today, we have been hearing about their personal stories as well. And it's so heartening. When I first started in the field a long time ago, because I earned this gray hair, and I used to talk about my family, and I testify at state hearings in state legislatures, and afterwards legislators would come up to me and they'd whisper in my ear and they'd say, "Me too, my family." And here we are today. Thank you all for sharing those stories. We're going to have one more legislator. We're waiting on him. Oh, he's here. Well, come on up, Melissa. Let's make that happen.
So traffic coming in from Baton Rouge to New Orleans can always be an issue, and thank goodness Representative Selders got here, but we've heard from some other folks that they've having some issues getting here as well. So Representative Selders from Baton Rouge is not only a behavioral health advocate, but he is in the trenches with us. He is a social worker and the executive director of a mental health and substance abuse clinic. He understands the work and challenges required to have access to care and health care parity. Representative Selders has serviced the 67th District since January 2020, helping the state navigate during COVID and those challenges that arose with it. Louisiana Mental Health Association nominated him for the work he has done to bring mental health care to the incarcerated in Act 214, signed by the governor in 2023, and House Bill 296, allowing patients to be monitored remotely when they cannot reach a facility for care. We are most grateful for his service and leadership on the House and Welfare Committee, helping the voice of behavioral health and firsthand experience. His passion shows when he took the time last year to be our keynote speaker at Behavioral Health Day at the Capitol. Thank you, Representative Selders, for all you do for our behavioral health community and for youth in our state.
Thank you, thank you, thank you. It is an honor to be here. It's an honor to advocate for mental health around Louisiana. Mental health doesn't have a color. Mental health doesn't have a party. Mental health doesn't have a social, economical tool. And so mental health is a real bipartisan issue that everybody can work with together. And I really love advocating. I really love what I do. This is the most vulnerable population, I feel like, in the state. It affects education, it affects incarceration. So everybody could use resources. So as long as I'm a legislator, as long as I can advocate, even if I'm not a legislator, I'm always advocate for mental health. And I appreciate y'all to continue to advocate and do the work for the people of Louisiana. Thank you.
Okay, I've been told by Kat I have to stand on this side of the podium. How's that? Because I would not want to miss being on camera. I'm so excited now and grateful to introduce a good friend of Mental Health America and a former honoree who has really been instrumental in making legislation happen in his state of Utah and making legislation happen nationally. Can anybody say 988? Okay, that's a whole different story, but that's part of it too. MHA's good friend, Steve Elison. Steve, come on up. Steve is going to tell us about some of the new innovative things that are happening in the state of Utah. And you'll hear about some of the things that has happened before and how we love to share the wonderful things that legislators are doing across the country so that it can get sprinkled in other states with their own special seasoning and flavor. Steve? Of course.
Thank you, Debbie, for the kind introduction, and thank you all for being here, for being a voice, and for being an advocate. Don't think that your voice can't make a difference, because it certainly can. I just want to share a couple quick stories, but I want to give a shout out to the next presenter, my good friend Tanja Miles, who, though she's from Louisiana and lives here, she frequently comes up to Utah. She's actually going to beat me back to Utah. We have the opportunity to work with the Huntsman family, the Huntsman Mental Health Foundation, on a number of initiatives. And I want to tell you, just give you a little preview, a quick report on some exciting things that had its genesis in Utah. So the Huntsman family made maybe the largest donation to mental health that we know of in America from a private family. About 5 years ago, they announced a $150 million gift, which in Utah was unheard of. They founded the Huntsman Mental Health Institute. I've been in the Utah House of Representatives. This is my 14th year, and I've been affiliated with about, I don't know, roughly 50 mental health bills, and I kind of felt like Don Quixote out there trying to get bills passed. And then all of a sudden the Huntsman family rides in, and all of a sudden mental health is cool. And they actually, they didn't ask for it, but when they announced this donation, we're like, can we name the institute after your family? And they're like, well, we'd be honored to have our name affiliated with mental health, which for so long, the stigma that's gone along with that, wouldn't necessarily be a normal thing. So one of the campaigns that they have put a significant amount, or one of the areas they put a significant amount of money to is the Love Your Mind campaign that the Ad Council's doing. Just by a show of hands, who's heard of that? Okay, all right, good, a good number. Just yesterday, actually, met with, had a meeting at the Huntsman Mental Health Institute back in Utah and heard from the Ad Council. They shared just a few statistics. They've had now, with the Huntsman kind of seed funding, have raised almost $50 million for this campaign. And last year, it was the most successful campaign from the Ad Council across all of the different campaigns they run, which is really substantial. They've had 4.3 billion impressions through different forms of media, an audience reach of 72 million, and they've had well over 1 million visits to loveyourmindtoday.org, and it's just building momentum. So that's just one of the things that originated back in Utah. I'm going to share just a couple really quick stories. I told Debbie I'm really good at managing the clock. As soon as I get the sign, then I stop talking mid-sentence. So a lot of times we'll work on different initiatives and we'll get frustrated. But I'm just going to share a story that sometimes failure is a necessary step to progress. So for years, me and one of my colleagues I'm in the House, my friend Dan Thatcher's in the Senate. We both got elected at the same time in 2010. And we had a really good friend named Laura Warburton, and she had a beautiful daughter who was in high school. And she had a TBI, suffering from mental health issues. Well, she placed a call for help, and that to a professional, and that call went to a voicemail. And that was the last call that her daughter Hannah made before taking her life. And Hannah's mother, Laura, was willing to share the story, and we named a bill after her called Hannah's Bill, that no call for help should ever go unanswered. And as part of that, we decided, we found out we had about 40 crisis lines in our state. We had our intern call all of them. Some went to voicemail, some went to a phone tree. Some of them, the clinician was carrying the cell phone home on the weekends, hoping the battery didn't die or they had cell phone coverage. And so we said, look, anybody can have a crisis line, but it has to be standardized. You have to have training, and it has to roll over to the National Lifeline if it's not covered 24/7. So we put a lot of funding and resources and policy into improving our mental health crisis system. Well, then we thought, gosh, wouldn't it be great if there was a 3-digit number that people could remember instead of that long 10-digit number? And so me and Senator Thatcher tried for several years to get a 3-digit number in Utah. And one of the large telecom carriers flew the hired guns into town to kill our bill. And I met with him, and I'm like, why are you trying to do this? This is a great idea. He says, it is a great idea, but it doesn't work well on a regional basis the way cell phone towers route numbers and the N11 system. He explained it all. I'm like, you're right. I'm like, he says, but you need to try to do this national. And I'm like, you're right. So I went back to my Senate friend, Dan Thatcher. I'm like, we're done. We're gonna quit. We're not gonna try to do this in Utah. That's 1% of the population. We're going big. Somebody said it's kind of like when Michael Jackson tried out for his high school basketball team and didn't make the team. It's like, well, I guess I'll just try out for the NBA. So we failed at the state level. So it's like, well, let's go big. And we worked with Senator Hatch and Congressman Chris Stewart. I ran a resolution in 2017 calling on Congress to get a 3-digit number. Of course, Congress moves at glacial speed, but it moved. And just to show, I love the comments earlier about mental health being, it's not just bipartisan, it's nonpartisan. It should be the most, the topic we can agree on the most because it cuts across every demographic. So the two bills that went through Congress to create 988, the first one passed unanimous minus one vote in the House, and I've forgotten that guy's name. I don't think he's even elected anymore. There's always one guy, right? But just to show how bipartisan it is, that bill just sailed through in the Senate, unanimous consent. So good things can happen, and if you fail at the state level, move to the national level. I'm almost out of time, Debbie. I want to give you a couple of just suggestions for ideas you can take back to your state. I'm speaking tomorrow at CSG, and I've got about a 50-page presentation. Don't have time for that today, but one of the highlights, like most of the all the bills I show, here's what the vote count was and here's how much it cost. And a lot of them were unanimous and cost nothing. One of my favorite bills last session cost $400. I'm like, if the executive appropriations doesn't fund it, I'll write the check myself. But a bill several years ago I ran that was actually the most controversial in terms of just looking at the vote count was a bill to put a process in place for schools to do mental health screenings. Now, if you think about it, how many of you either had a vision or a hearing screening when you were going through school? Yeah, I mean, almost everybody. Some schools even do dental screenings, scoliosis screenings. Well, in Utah, suicide is the leading cause of death for children. Nationally, it's, I think, number 2. Yet, we don't do any screenings. Mental Health America is a leader on your website with access to screenings. I work, again, for University of Utah Hospital, my day job, working with collaborative care and depression screening. And we know that these screenings can be extremely accurate at predicting, the presence of a mental illness. So I ran this bill, and I just thought, this will be great. Everybody's going to agree with it. Oh, no. People started freaking out. And I got it to where it was into the Senate for final passage, and a state school board member showed up to try to kill the bill, and somebody's like, you better go talk to her. So I pulled her aside, and this thought just came to me. I said, I've got a question for you. I said, are you also trying to get rid of vision and hearing screenings in schools? And she says, no. Why would I do that? And I said, well, because those are issues that also go wrong above children's necks, but they don't take their lives. She didn't know what to say, and then my intern called and said, the vote's on the Senate floor right now. And I said, can you wait right here for just a minute? I'll be right back. She didn't know the vote was up. So I ran over and ran around the floor, getting people to flip their votes, and the bill barely passed. Well, that was about, 4 years ago. And you had to use evidence-based, age-appropriate screeners with written parental consent. Those were all key elements. Well, only about 30% of our school districts took it up. And so I ran another bill that said, okay, it's still voluntary for both parents and for school districts, but the school districts, the school boards have to say either we're in or we're out. There's no more lukewarm here. You got to be hot or cold. And I went to one of our largest school board meetings where they were voting on this, and they said, Steve, will you speak? And I'm like, I'd be happy to. And I said, let me tell you who I wouldn't want to be. I wouldn't want to be a school administrator, a school board member who had voted to not give a voluntary resource to parents, to empower parents to help their children by voting against this free resource. And I said, and then what would be even worse is if then you have a child die by suicide in your school, or heaven forbid have a school shooting, knowing that most school shooters are dealing with some sort of mental health issue. And then I just dropped the microphone, and I wanted to, but I went back and sat down. They voted, and it passed unanimously. And now, given enough time, 90% of our school districts, after they had to vote on it, said, we're in. And the rest of them that voted no says, just give us one more year, Steve, and we're going to get there, okay? We just got to make sure we have the resources. But part of that bill also included funding, so if a child, if they had to partner with a local mental health organization to do the screening, so if there was something that presented, they could then do a warm handoff with that mental health provider and the parents and say, here's a resource you can go to. And was also funding the bill, so if they couldn't pay for it, maybe had a high deductible health plan, and we have a way to help you pay for it. So that's a bill that I have more I could talk about, but I'm out of time. That's just one idea that until we have that across the nation, I don't think we're doing our children justice or giving our parents the resources that we need. So I wish I had more time. Thank you, Debbie. Thank you for Mental Health America for all the advocacy you do and for all that you do. Thank you.
Thank you, Steve. It's just so exciting and wonderful when these ideas get shared across the country. I'm gonna step up here because I'm really short. Okay, here we go. I'm gonna pat our Mental Health America team that puts together our State of Mental Health in America report. As I mentioned, on the table are the 10 cards to take our survey and tell us what you want. But Steve, I'm gonna tell a tale out of school. So when, early on, about 5 years ago, before the Huntsman family got involved, Utah was 50th in our survey. And Steve called and said, I'm gonna go talk to the governor, I'm gonna talk to some people in Utah about some things that maybe we can do and have some ideas. Let's share ideas about what we can do to make things better. And that's where the Huntsmans came in, and Utah has really moved up in doing wonderful things, and part of that is really thanks to you, Steve, and all the amazing bills that you very gently got through the legislature, so we really appreciate that. I'm going to give you another hand. Okay. Now, speaking of the Huntsman Institute, we have with us Tanja Miles, who represents the Huntsman Institute, and Tanja is one of the most amazing, inspirational folks who are working in mental health today. I'm going to let her tell her story, and hopefully, I know she will inspire us all. And I'm going to shut up and invite you up here. Tanja, we're so grateful for you being here today. Do you have slides? Here's the clicker. I think I have it upside down. There we go.
I am just a child, I know. Everything I am will grow. Things that hurt when I am small grows much bigger when I'm tall. Fa la la la, la 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 la, fa la la la, la 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 la, fa la la la, la 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 la, fa la la la, la la la. When I was 7, I had dreams to be on Broadway. I was this little girl. That's me in my Forrest Gump getup. That is my mom. That is me and my brother. My nickname was Tiny Bit, as you can see why, because I was teeny tiny. And I had this big personality. I loved to make people laugh. I loved to sing. Matter of fact, I knew how to sing. You know Al Green before I knew my ABCs. And if y'all don't know who Al Green is, you should Google him. And I just liked to make people happy. I loved it. So we lived in Baton Rouge on 36th Street. And so we were poor, but we didn't know it because my grandmother and my mom and dad, my dad was a Vietnam vet, so we stayed with my grandmother. And so my family did a great job of, protecting us from poverty, not to really let us know how poor we were. Growing up with roaches was a thing. The smell of them, them infesting, our food and things like that, that was normal to us. But what was also normal was the love that we had, the faith that we had. And we had, in spite of everything, I had a good childhood. This is me doing my thing, y'all. Like I said, I love to entertain. That's my brother Kevin. That's my sister right there. And those beautiful legs are the legs of my mama. And so I just love to make people happy. I did. I saw myself being on Broadway. I saw myself on stage, just singing and just really making people feel good. Everyone loved to come to my grandmother's house because what we did was my grandmother sold suppers or dinners to make ends meet. And so I was the entertainment. This little girl who had hopes and dreams to sing on Broadway, to entertain people, to change the world. Everybody said, Tanja, you got this gift of gab. Yes, I do. I did, still do. You're going to do great things. But one day she died, and nobody grieved for her. She died, and nobody grieved for her. I used to sing in this choir, Baton Rouge Community Choir. And this song I just sung, which I hadn't sung probably in about 50-something years. This is my first time singing it in public. The man who wrote this song and had me sing it did not know I would be basically singing about my life. I am just a child, I know. Everything I am will grow. Things that hurt when I am small grows much bigger when I'm tall. That's trauma. He had no idea that that little girl who was singing, who was acting, who was on stage, was suffering in silence. Did not like the skin she was in because of the color of her skin, because her nappy hair, but mostly because she was molested. I turned into a monster. People used to always ask me, Tanja, what the hell is wrong with you? But nobody asked, Tanja, what happened to you? By the time I was 13, I was singing in clubs and I started using drugs. My first rape was when I was 13. I continued to do drugs because I did not like who I become. That little bitty girl who had this little bitty body, all of a sudden my body betrayed me. Because people always told me if you're out there being fast and you're letting guys do things to you, you're gonna develop quickly, and I did. And I hated myself even more because I became this person in the mirror I did not know. A lot of bad behavior. The teachers, Tanja, you're so talented. Why is your conduct so bad? Why are you daydreaming? Why is it that, my mom, you're still sucking your thumb at the age of 13? Why are you still wetting the bed at the age of 16? All of those things that are related to trauma. When you talk about the ACEs, and the first time I took the ACE test, when I scored myself, I was horrified because everything the test said of a person like me who has a high score, all of those things happened to me. The drugs, the gang rape, the violence, guns to my head, the drugs, the places that I worked, OD'd, and I told God, if you get me out of this hotel, I promise I would not do this again. And I end up doing it again. Selling my body for drugs, not just for the drugs, but for the thrill of it all. The 3-time suicide attempts, 2 in a hospital. The first one I was homicidal and suicidal. I hated who I became. I lived my life to die. All because of trauma that went untreated. My mom and dad were good people. My mom was an alcoholic. My dad, who served in Vietnam, he was a functioning addict. But I thank God that at the end of the day, they instilled in me a will to fight. They instilled in me a will of purpose that trauma trumped. You see, when we talk about all these things that you guys are doing all this amazing work on, talking about mental health and substance abuse, we have to look at what the root cause are. What are those root causes? What would cause someone to, risk their life to use drugs when we know that fentanyl is taking people out left and right from the curbside to the country club? What would cause someone to risk their life when drugs hijack your brain because there's so much pain that you would do anything to release it. All the cutting that I did, all the things that I did, the sex to numb the pain, then there was shame, and all the other things that you guys know that happens. That's why policy, that's why having meetings like this is key. As Steve was talking, and he talked about the screening, I only could think about was my parents. What if my parents knew that they could reach out to the school because they saw their daughter struggling and say, is there something you can do to help her? What if there was a screening that kids had access to help them figure out what was happening? Because if you think someone would wake up every day and say, you know what, one day I want to be a crackhead, one day I want to be a prostitute, one day I want to have a mental health diagnosis. That is not the case. Life happens. Matter of fact, it happens to all of us. And so it is up to us that we give people the adequate resources and the help and awareness that they need to get them from their worst day on their best day. And I know if I can do it, others can, with the right resources, with the right awareness, and of course with hope. Look, I'm a military girl. I was in the military for 9 years. I love being in the military. It was cool. I love basic training. Matter of fact, I went to basic training. I aced that mug. Why? I'm glad you asked. Because my dad treated me like I was in the military because he saw his young girl, his daughter, who was gifted and talented, but she's struggling. Why would my daughter want to kill herself? What is going on? He didn't know. Back in the day, matter of fact, in my culture, you were told, you better pray about it. You better not tell nobody that. That's some other people problem. You know, that's what other people do. They go to doctors. You don't do that. You're going to pray about it and sweep it under the rug, baby. Let me tell you about sweeping stuff under a rug. You can sweep it under a rug all you want to, but before you know it, that it's going to build a mountain and a hill and a mountain, whatever you want to call it, and then somebody's going to trip over it. Because trauma, we all know, is just not that individual who's suffering, but it's the family as well. And so when we talk about trauma, it can't be something that, you know, we talk about and we say that's needed. It's something that we have to make sure once it's identified, people can get the right resources. Again, what if? What if there was a screening tool in the schools? Do you know how that would have made my parents feel? Or the teachers who say, Tanja, you're doing all this great work, but your behavior is through the roof. Those are the kind of things that are necessary. And I'm grateful that you guys meet and you want to address. Because here's the deal. Like I said, I'm a military girl. I believe if we got a mission, I'm going into the mission knowing that we're coming out victorious. I also know in the military, one thing that they teach you is about camaraderie. We all need each other. The day of the one-man show is over. If we really want to continue to move the needle, we have to work together like you guys are doing from every aspect of every piece of the puzzle, from legislations, from social workers, to advocacy, to peer support specialists, to doctors, to pharmacists. Everybody, we have to work together. And I don't know about you, I'm not discouraged about 2025. Matter of fact, 2025 is going to be epic for as I'm concerned. Why? Because at the end of the day, it's all or nothing. And because it's kind of cool that Louisiana, we got some power on the Hill. Look, I'm neither Democrat or Republican, I'm an independent. But the people that I work with, they know my work and my worth. So they know the importance of mental health and substance abuse. It's not no coincidence who's on the Hill, who's from Louisiana. You guys can Google it. And will I work with each and every one of them? You better believe it. Because at the end of the day, one thing I know, from the curbside to the country club, from being broke to billionaires, addiction and mental health does not discriminate. And when it's all said and done, we all have a lot in common. So I just want to encourage each and every one of you to continue to fight the good faith, because trauma is real. People are facing trauma every day. Families are facing trauma every day. Communities trauma is affecting them. But at the end of the day, how do we make ourselves healthy? Well, we have to start with the individual. Because when you can have an individual, when you can help an individual be healthy, that family becomes healthy, that community becomes healthy, and before you know it, our country. See, I still believe, I have to. Like I said, I'm a military girl. And look, if anything pop off, you will want me to go back. I love fighting. Yes, PTSD, you have either fight, flight, or freeze. I got the fight thing. I'm my daddy's daughter. I will fight you in a minute for a good cause. That's right, a good cause. And so we all have to continue to fight the good fight of faith. We all have to wake up every day and believe that the work that we're going to do is going to make change. But we have to remember it's going to take all of us. Look, I'm not going to sit in another meeting where it's talk heavy and people are talking about pie in the sky solutions that don't trickle down to everyday people. There's a big gap, and we have to be the ones that fill it. I mean, look around this room. I see Karen Stubbs. I've been knowing Karen, the assistant secretary, for many, many, many years. And I'm grateful for Karen. I'm grateful that Karen, I can call Karen and say, Karen, there's some things going on the ground. I think we can course correct and make happen. And Karen would say, Tanja, I trust you. Let's put finances to do that. Look at Representative Selders. I mean, a social worker and a state rep? Are you kidding me? I mean, he got the juice. And the work that he does. Or Trevor with the coroner's office in Baton Rouge. When fentanyl hit our city like it did everybody, we all began to work together. Or Steve Elison, you cannot make this up. That, you know, here I am from Louisiana, and I'm working with the Huntsman Family Foundation, and one of the people that I meet out the top is Steve, who's one of the smartest people in the room, but he's compassionate. Or Melissa. And y'all, let me just say this. I know the rest of y'all are cool, but Melissa's scary in a good way. Nobody tells Melissa no at all. You just say, okay, Melissa. You know, so there are so many good people in this room who are making things happen. And if it could start with us like it already is, imagining how it can trickle to the rest of the world. So I just want to encourage you guys, as we go on about policy and legislation, you know, trauma is real, but so is recovery. Trauma is real, but so is recovery. Don't get weary in well-doing. We know that this is hard and heavy work, but I want you guys to remember, Lil Tanja, I spent my life blaming myself for that. I spent my life blaming what happened to me as my fault. No more. Because when the pain finally had a name, it all made sense. And that's when EMDR, we talk about research, all those things are key. Therapy ain't scary. You know, I love my therapist, for real, for real. She make me mad, and she make me sad and excited all at the same time. But she's a good therapist. Or my psychiatrist, my psychologist, my family, my friends, who know that when I'm struggling, what they need to do to help me get through. Look, because I beat addiction. I went cold turkey. But the mental health piece, whew, what a journey. Tanja, you know, as I saw the movie Wicked, and I saw it on Broadway, but when I saw it at the movies, and it had some more in-depth things that it was addressing, do you know that movie was mostly about trauma? And I remember, you know, this year with all the amazing things that I've been doing, at some time I felt like I was free falling. And as I, you know, was looking at the movie, a lot of times I was trying not to cry and was holding all my emotions in. But at the end, when Elizabeth finally got the broom and her cape, and she began to jump, and she was falling, she was falling, she was falling. And she said in the movie, for so long, because of the trauma that she had went through, she blamed herself all these many years, until truth was portrayed to her, truth was presented to her, grace was presented to her, love was presented to her, her being herself was presented to her. And I remember looking on that big screen, and as she was falling and she was falling, and then she saw her 7 or 8-year-old self. I saw myself that day. And so with all of us, I encourage all of us, the sky is the limit. Let's think big, let's go hard, because there's so many people that need us. But at the end of the day, I need you guys to take care of yourself too, because you matter. You matter so much for this work. And we are a part of a military operation that I believe we can be victorious at. Trauma is real, but so is recovery. So when you get tired or you get pissed off, mad, sad, all of that, you remember Tanja. You remember Tiny Bit. You remember that if it can happen for her, it can happen for others. Equal access, dignity, and respect when someone is brave enough to walk into a treatment center and say, I need help. Wow, that's a lot. So I just want to say thank you guys so much. Thank you for what you do. Thank you for what you sacrifice. Because at the end of the day, I believe that we can do this, because the cavalry ain't coming. It's us. It's going to take us. And us together is a force. Again, I see the future as being bright. If we don't see it as being bright, then we need to stay at home because we're already defeated. So collectively, let's take our resources and our work, our hopes and dreams and visions, and let's do this, because people's lives are at stake. And I believe with all my heart and all my soul that we will continue to make a difference like we already have. What a great day this will be. Be encouraged. Love on yourself. Love each other. I cannot thank you, Mental Health America, for the work that you do all across the country. But see, that little girl right there, she's not blaming herself anymore. What the enemy meant for evil, God is turning it around for good. So if you're ready, let's do this, because we can and we will. Thank you.
Okay, folks, you ready to get to work? At Mental Health America, we love to expand in new ways. We love to find new solutions. We don't forget about old ones. We like to find new ones. And what we really like is having the backing and the science. We need the motivation. We need the understanding about trauma being real and trauma being healing. And we've got some new things that are happening in the policy realm. And I know you've all been sitting for a long time. We're going to take a break after our next speaker. And I want to invite you all, while you're sitting here, to really focus on what you're about to hear. And I have my little mask here to tell you about and to help you focus. So if you haven't noticed these wonderful masks on the table, and thank you, Alicia, for getting them for us. And these sticks, no, I'm not putting my hair up with the stick. These sticks, if you will scratch on your mask, you will be able to decorate your mask and help really hold your attention as we move into looking at a new policy realm that's upon us. We don't know where it's all going, but we're going to talk about it. And that's some new things that are coming about healing trauma and using psychedelics to do so. We're so thrilled. Charlie, it's such a pleasure to have you here. We have Charlie Panfil from the Daschle Group, and if any of you remember Senator Daschle, you know that he's still doing some wonderful stuff policy-wise. And because we're all here representing the states, Charlie's going to tell us about what's happening in this new realm in the states and how we might be a part of this and how our advocacy can play a part in it. And yes, it's heavy, and we're going to hear a lot more about trauma too, but right now we're going to hear about some wonderful legislative advocacy and policy steps we might take. Charlie, come on up. Welcome.
Hi everyone, my name is Charlie Pan. I'm a public policy advisor at the Daschle Group. As Debbie mentioned, I work with former Senate Majority Leader Tom Daschle. I'll go to the next slide. Why I'm here, that's me. I work on our healthcare and energy teams at the Daschle Group, work with both sides of the aisle at the federal level and also help some folks on the state level. I've been doing this work for about 2.5 years now with both veterans and then also Otsuka America Pharmaceutical, really focused on how we take a science-based bipartisan approach to breakthrough therapies for mental health. You know, we've heard a lot in kind of popular media and mainstream media about psychedelics, but you know, Joe Rogan's podcasts don't get us all the way there, and so we need to talk to some of our state and federal legislators about some of the solutions that we've been looking at there. So. As we all know, earlier in November we had an election. Republicans on the federal level swept the White House, the House, and the Senate, which changes our policy planning going into the new Congress with the new administration. We've had a second Trump administration begin to take shape, most notably with Robert F. Kennedy Jr. nominated to be the next HHS secretary. As folks may know, he's been a very vocal supporter of things like psychedelic-assisted therapy for a long time, and some of the other appointees that have filled in HHS are as well, including Dr. Oz, who may be the next CMS administrator. The other folks to also keep an eye on as we go into 2025 include the next Attorney General, Pam Bondi, who was the former Attorney General of Florida, as well as former Congressman Doug Collins from Georgia, who will be the next VA secretary. I'd also updated it with who was supposed to be the DA administrator, but he dropped out yesterday, so we'll get to talking about that in a little bit. But some of the other nominees that are still kind of outstanding that'll inform a lot of what this field can look like in the coming year include the director of the Veterans Health Administration, the next director of SAMHSA, and the next director of the Defense Health Agency. And as we all know at the federal level, you know, there are too many agencies and acronyms to count, but all of these folks have a different role within the way that healthcare policy is made that trickles down to the states, which is what we'll also talk about today. But I'll go back just for one quick second, because I think some of the agencies on here, you know, as we talk about the traditional healthcare space, continue to be important regardless of the healthcare solution we're discussing. The FDA obviously approves drugs that are allowed to be used by doctors. We saw that the FDA rejected MDMA in August of 2024 for some larger issues outside of whether or not the drug is effective. But that will continue to be one of the most important tools in how we look at what tools will be available to doctors and providers looking to help patients with a wide variety of indications, whether it's PTSD, postpartum depression. I saw the discussion about maternal mental health earlier today. But like I said, PTSD, postpartum depression, generalized anxiety disorder, treatment-resistant depression. We'll have a whole new kind of list of possible treatments for folks that especially have been trying other solutions that have not been working, especially with treatment-resistant depression. That, as we've talked about with multiple speakers today, these mental health issues cut across demographic groups. And we're continuing to see, an increase in PTSD, especially among the veteran population. But the majority of PTSD patients are women, actually, who have either are women veterans or have been the victims of some form of physical or relationship abuse. So there are a lot of constituency groups to engage on this issue. I've even talked to groups that have looked at psychedelic-assisted therapy for the children that survive so-called conversion therapy and what their parents put them through. And that's another group, again, that we can look to. Also have talked to folks out in Hawaii, for example, and I know we're talking about a little bit later today, but the survivors of natural disasters have a lot of PTSD, a lot of depression. They may have lost everything, as we've seen folks, especially in this part of the country, with the hurricanes that have come through this season. There continue to be expanding groups of people that could benefit from therapies like this, and especially have to line those therapies up and their success with some also successful policy initiatives. So I'll skip through here. We're also going to have a lot of change at the federal level this year. This applies to anyone looking to do healthcare policy. We have a new incoming Senate Republican leader, Senator John Thune, who succeeded my boss as the senior senator from South Dakota. We're also looking at new leaders on the Energy and Commerce Committee. And I know healthcare is not in the Energy and Commerce title, but it is one of the biggest healthcare committees in the House. And this is really an important race, especially in this area, because Congressman Guthrie is the current chair of the Health Subcommittee in the House, which has really driven the conversation around mental health and substance abuse with things like the Support Act, different issues surrounding fentanyl and overdose prevention. And so, Congressman Guthrie as chair, from my personal opinion, I will say, creates a more health-forward and health-focused Energy and Commerce Committee, but will also be in good hands with Congressman Latta. We also have, from the great state of Colorado, a new Democratic leader on that health subcommittee with Diana DeGette. And I don't know if folks have met her before. She's very nice, very health-forward, and also very supportive of some of these psychedelic policy initiatives, especially from her home state of Colorado. And then the other person I want to highlight, who is personally one of my favorite members of Congress that I'm very close with, is Dr. Marionette Miller Meeks out of Iowa. I don't know if we have anyone from Iowa in the House today, but has taken a really great approach from both the veteran and the doctor's perspective, and how we talk about these therapies in a way that breaks down stigma and also makes this more of a serious conversation rather than some of the other things we see on social media. But what I'm here really to talk about today is a state overview. I know that's what Debbie wants me to talk about. So after the kind of federal highlight, I want to change to the state level, and then happy to take any questions or have a discussion. I'm not really a PowerPoint person, so I'm much easier doing a discussion. But we did have some setbacks on Election Day. Question 4 failed in Massachusetts. There were also local votes in Oregon related to psilocybin centers. So there have been setbacks, but that's not the whole story. And I think actually speaks to, the skills of everyone in this room is you guys are the experts in talking to legislators and bringing about some of that change that doesn't necessarily need to go to some form of ballot initiative or other vote, especially when talking about complex healthcare problems like mental health and finding new solutions for trauma. And so when it comes to state opportunities this year, I wanted to highlight 3 general categories. We've already talked a lot about access, so we'll start with insurance and care. Just because the FDA approves a drug today does not mean it's available tomorrow to patients, especially when we're talking about a drug that is currently a controlled substance. We've seen similar things with, whether it's Adderall, other drugs that are on the controlled substances list. There needs to be a lot of more steps that actually typically happen at the state level. So first, talking about insurance and care, being in touch with your state medical and nursing boards continues to be helpful. Right now, if I'm a doctor in California or I'm a doctor in Florida or wherever, there are a lot of barriers, and I could risk my my license to practice medicine if I was counseling patients or helping patients use psychedelics, right, without an FDA-approved product. And so as we get closer to an FDA-approved product, whether it's from folks like Compass, who I know is a sponsor of today, talking to your state nursing and medical boards to make sure that providers are ready to use those substances with their patients will be especially critical. The second is also partnering with law enforcement. I do a lot of work with law enforcement groups where their answer to me, and it's very similar for things like cannabis as well, is I have more serious things to focus on in my community other than if someone is using psychedelics for PTSD or using psychedelics for their depression. So I think where folks can have those law enforcement discussions within their communities becomes especially important, and having this conversation around, this is medicine, this is, approved by a doctor, used with a patient that has, whatever indication this is being used for, and is not, just handing out drugs and telling people to go home. So I think partnering with law enforcement continues to be helpful. The second is every state's Medicaid coverage is a little bit different. And as we have new tools available, also making sure that your state's Medicaid program would cover something like this, especially because, as we've heard today a lot, there is not equal access to healthcare in the United States. It's just a fact. And we can do our best to make sure that folks have access to the newest treatments and aren't left out of an innovation just because of, the income they make or what their socioeconomic circumstances are. So I think talking with your state's agency that manages Medicaid or your governor's office is really important, especially because with a lot of these therapies, it's a drug component associated with some form of talk therapy or other psychological support services from a mental health practitioner. And because of that, there again continues to be complexities with coverage like we see for any health condition that requires, either multiple types of therapy or, drug combination therapy. We're going to continue to run into some of those issues. And then the last two kind of go hand in hand. But looking at your whole state, where are there gaps in access to care? And we've heard a lot about rural communities, but there are care deserts even in urban communities where there may not be enough, mental health practitioners, whether it's psychologists or psychiatrists. So I think, continuing to have that conversation about workforce development and access to care statewide is especially important not only for this issue, but for others. The second kind of column is, in addition to the Federal Controlled Substances Act, every state also has their own Controlled Substances Act. And some states are different. About half the states automatically follow whatever the federal government does. That second half of states requires some other action, whether it's from the governor or your state attorney general or the state legislature, to update their controlled substances list once the federal government makes a change. And so there have been folks doing great work on this because, what we could run into is, again, you'll have 25 states where therapies like this are available and 25 states where they're not. And we need to make sure that there is not this patchwork of care where, again, your zip code is affecting the mental health care that you can receive. So I think that continues to be important, and I think it's something that as folks go into 2025 legislative sessions in their states, is something to really think about. This could apply to psychedelics, this could apply to other things as well, like fentanyl and other controlled substances. But having that conversation in those states about where there is not kind of that automatic switch, I think there needs to be a conversation about, why that's there, if that's been a long time, policy, and does it need to change. This third bucket is funding and research, and I have some states shouted out, and I know some of them are here in the room today. There have been a lot of what I would call model states for addressing this issue. A lot of states, including the great state of Louisiana, have research going on in the state, including at the Louisiana Addiction Recovery Center, which I know is part of LSU Shreveport. You also have states like Indiana, Utah, who have made really good strides in getting research and pilot programs out so that when drugs like this are approved, their states are ready. So like I said, some of the states that have done a great job are, Arizona, Indiana, Illinois is another one that's done a great job. Some other states have also formed working groups or committees or other things like that that have also been studying these substances and if they're right for your state. I think those are a great opportunity, especially if someone from your chapter can be on one of those, but also because it starts to put the state government on the record about, are these substances the right thing for my state? And what we've continued to find over and over is as these states look at the benefits of psychedelic-assisted therapy in their state, the answer is pretty much unanimously yes, that we should have some of these available, whether it's psilocybin for first responders or veterans and other groups. So that continues to be, I think, one of the model ways that we can slowly start to address this issue. As we've seen before, the Oregon and Colorado models have been successful in some ways, unsuccessful in others. But I think the best path forward that also kind of brings the biggest coalition with us is really focusing on medical access to these substances, not decrim or recreational use, and making sure that these medicines stay with a doctor and are used with the patients that need it most. So that's the end of the slides that I put together. I'm happy to answer questions, or if there's folks who have any questions about their state or what their state can do, or any form of discussion, I'm happy to answer those questions. But I'm much more of a conversation and questions person than a slides person. So happy to answer any questions. Sure.
So where do you see, say, the therapists, I'm an LCSW, I'm very interested in psychedelic assisted therapy.
Yeah.
Where do you see our role moving forward to try to get trained and be able to facilitate these?
Yeah. Yeah, so social workers. Oh, sure thing.
Get the microphone in time so our folks who are listening to the recording can hear.
Okay, sure.
Thank you.
Yeah, so I think what's important to understand, I think so the question was, what role do social workers play in facilitating this care for patients? And I actually think social workers are one of somewhat the required practitioners in this space, because the way psychedelic-assisted therapy generally works for folks who aren't familiar is you use these substances under the supervision of either one or more providers only 1 to 3 times typically, and that achieves a lot of success for patients so far. We're seeing 70–80% reduction in symptoms. We're also seeing very high what we would call remission of depression rates among folks. But that's not the end of their care journey. The psychedelic-assisted therapy is typically split into 3 portions. You have your preparation, your administration, and then what's called integration. And integration is taking, the results of that care and implementing them throughout the rest of your life. And that, I think, is the main role for social workers, is making sure that the folks who need this care most get this care and then are successful with its effects long term. And so that's where, again, where the state medical and nursing boards come in, whatever the state equivalent is also for social workers, is making sure that your state is ready to certify folks and make sure they're licensed to provide this care, or that providing this care doesn't put their license at risk, I think is the most important thing. That's what I've heard most from doctors is like, hey, I'm happy to do whatever training or courses I need to do, like that's no problem, but I don't want to risk the rest of my medical practice to help folks that need this. But I think social workers will continue to play a really important role in making sure folks can really experience the long-term benefits of these therapies, especially because folks are likely going to be, at some of the lowest points in their life when they need this care. And that goes with a wide range of mental health care options. But, we want to make sure that patients can start to get better and succeed in life. So I hope that answers your question.
Yeah, I'm just saying, like, for training and moving forward, because they have the psychedelic-assisted trainings for therapists, and you can get certified, I guess. But like in the Oregon and in Colorado models, where do the therapists play the role in those facilitations of the, say, the psilocybin-assisted therapy,
right,
and things like that? Are they present in the process there? I'm not familiar with those 2 states and how the process goes, so I'm just curious about how they're doing that.
Sure thing. So the question was what is the role of therapists and social workers in states like Oregon and Colorado where there already has been some action? And I think that continues to be a flaw with the models used in Oregon and Colorado. So in Oregon, for example, you're taking, a 100-hour training course to be a facilitator in that state, and no one's really a certified healthcare professional, right? So I think that's a huge gap, and why, personally not a fan of that setup. In Colorado, there was some improvement, but the kind of overall answer is that there isn't necessarily a huge role for some of those healthcare providers because they're not included. Because folks, can't be a doctor and help folks out, or again, same thing with therapists and social workers. And so that's why continuing to push for really a medical focus with an FDA-approved product in this area will continue to be the most important, so that folks, like I said, are getting the care that they need from the right people as well.
So we're just going to be referrers, basically?
Yeah, that's the question was, is essentially a referral process, and the answer to that is yes. I mean, the other thing too is without an FDA-approved product, this is all out of pocket, which again becomes an access and equity issue. So folks are paying, $3,500 for a psilocybin-assisted therapy session, and they just should not be. Hopefully we'll get to a place where there should be insurance coverage, so maybe a copay or something like that. But yeah, no, right now it's essentially an out-of-pocket system with folks who are not certified healthcare professionals, which again, I think we can serve, whether it's folks in Oregon or other states, we can serve folks better than that.
I'm sorry, does anybody have a question? Sorry. Are y'all looking at Canada and how they're managing that type of...
Okay, yeah. So the question is, the effects in, the models in other countries. Canada's up there. Another country that is really taking the lead on this is actually Australia. And so those two countries are looking like models that the U.S. can emulate. I think, this is unfortunately an example where, the United States is typically the leader in healthcare research and development. This is an area we've fallen behind because of the stigma around these substances. But yeah, like I said, these countries hopefully can be a model. Our healthcare system doesn't necessarily match up to them, so there is some discrepancy there. But again, those are countries that have really taken a strong leap forward and are seeing great results.
We have time. Okay, I'm gonna get Chris here, and then I'll come and see you.
Good morning, and thank you. I've been in the veteran community for quite some time. You mentioned veterans and post-traumatic stress. It's big. I know a lot of the influencers are talking about it, and there's some amazing research out there that says it's a great treatment. My caution, and I guess my concern, is really around abuse, misuse, and things like addiction, and what we don't know. And I go back to things like opioids, right?
Right.
I'm sure it was a life-changing treatment at the time, and now here we are. So are any countries or states kind of putting in guardrails for things like abuse or misuse or addiction? Anyone out there thinking about that or putting policy towards that?
Right, so we typically call that abuse and diversion. And really the model for this treatment actually kind of answers your question. So this is medicine that does not leave the doctor's office. It's administered under the supervision of a healthcare provider. So this is not like go get your take-home MDMA at CVS and like go home with it. And I think, that was one of the issues that we've seen in some states with medical cannabis, right? Is you had folks getting a medical marijuana card, maybe they did or did not need it, that's not up for me to say, but, and going home and using drugs at home. The model for this kind of care, like I said, is supervised administration, typically only 1 to 3 times. We're also not talking about, large doses by any means, especially with psilocybin, which is also not addictive. We're talking, 5 to 25 milligrams of a substance at a time. And so not as much of a chance for addiction there, and actually some psychedelics are really effective as treatments for substance use disorders. Psilocybin is effective, or likely to be effective, for alcoholism, and there are other substances called ibogaine and 5-MeO-DMT, which a lot of veterans have used, is probably what you've heard of, which is actually how a lot of veterans who have been prescribed opioids have gotten off of opioids. And so I think abuse and diversion, preventing abuse and diversion is one of the biggest kind of, pillars that companies are looking at. And then also with other substances too, once a drug is FDA approved, REMS can be attached to them, and REMS are risk evaluation and mitigation strategies. And that will also oversee, prescription, administration, things like that, to make this as safe as possible.
Thank you.
I think there was one more.
Charlie, thank you. Very insightful, very, very informative. And I wanted to build upon the point that you made earlier in terms of the U.S. being really the global leader in research and development. And a couple of years ago, as you know, Congress passed, the outgoing administration signed the Inflation Reduction Act, or some have dubbed it the Innovation Reduction Act. And we've got that at a federal level. We've got their little ugly cousin, the prescription drug affordability boards, at a state level. And I'm just curious, when you look at a big picture, unfortunately, we've seen a decline in neurological and psychiatric research the last 10, 15 years.
Right.
A little bit of an improvement in the last 5. But I'm just curious how you see both of those at a federal level and even at a state level, and the impact that that could have on the research and development ecosystem that arguably is the best in the world.
Yeah, so I think specifically related to, or you mean specifically related to psychedelics or just in general?
Just in general.
In general, yeah. So I think, part of the conversation we've started to see some of the incoming appointees to the new administration have really gets at, both parties recognize that Americans pay more for healthcare than anyone else in the world, mainly because Americans are eating a lot of these R&D costs. And so there continues to be conversations about how can those R&D costs be spread across countries, where, a drug here in the United States is $200, but in Europe is $8, right? So I think that will be there. In terms of the Inflation Reduction Act and the drug pricing provisions within it, that'll be 10 drugs a year for the next, I think it's like 5 to 6 years, something like. Yeah, it goes up. I know it goes up over time. We have the first set on the list. We'll continue to see how that affects R&D, and if it substantially does, I think there could be a conversation about, hey, does this program need to change? But I think it's one of those things where now that it's law, it's going to be hard to undo. No one wants to be the party that raises prescription drug prices. So that I think will continue to be a discussion to have. But I think there are also a lot of other legislative tools and policy tools on the administration side that could be used to lower costs for consumers. But related to psychedelics, this is actually an area where R&D has also been up and down. But there continues to be a steady increase over time. A significant number of companies, even some of the companies on our sponsor board, have either acquired psychedelic pharmaceutical companies to continue helping them develop drugs, or individual biotechs have kind of sprung up from this. A lot of the drugs under FDA review contain, in the psychiatric department at least, now contain some form of psychedelic ingredient. And I think the conversation we're going to start to have is about total cost of care. Right? If we're saying that a psychedelic assisted therapy treatment round costs $12,000, that's more than comparable to infusions for other conditions. But also, if we get long-term results, whether it's that 70% reduction in symptoms or the folks that are experiencing remission, then the conversation starts to become, okay, if I can help put a patient closer towards remission or in remission of depression, that means that they aren't spending money on a monthly prescription, probably more than one antidepressant prescription, weekly or monthly therapy appointments. So I think there really can start to be kind of this healthcare economics conversation about how we can drive the cost down for mental health care with psychedelics.
Yeah, no, I appreciate that. And certainly there were a couple of aspects of the IRA that were positive, right? I mean, when you talk about the out-of-pocket cap, you've got the smoothing provision, although operationally it's pretty complex. It looks like this year the cardiovascular community took the biggest hit there, and at least talking to disease groups and even industry partners that are more invested in that space, it doesn't seem like it's a true negotiation. Thankfully, I think mental health has largely been kept at a safe harbor, if you will, but my overarching concern is what does that look like 2-3 years from now? So I appreciate your insight.
Yeah, I think, the last thing I'll add on that too, just because I do a lot of different healthcare issues, and one of them is vaccines. Vaccines could be affected by the IRA in a place, for example, with the flu vaccine costs $40 out of pocket, mandated to be covered by insurance, doesn't necessarily need to be price set. So I think there will continue to be some conversations about implementation going forward. But happy to answer any other questions, or if I'm out of time, I'm out of time. Okay.
I have a question, but I'm not knowledgeable, so you're going to help me ask it.
Okay.
I am starting to learn a little bit about the FDA process that drugs have to go through, and I learned about something. It's an acronym, which I'm bad at. I think it's PDUFA. Is that right?
Yeah.
So can you talk a little bit about how that can either help or hinder innovation specifically to psychedelics?
Yeah, so the FDA is a unique agency in that about half its funding actually comes from pharmaceutical companies. And so the next PDUFA will be interesting because the possibly incoming HHS secretary does not like that model and does not like the idea that pharma companies are paying the FDA to evaluate their drugs. But those bills, I think we're on like PDUFA 8. Someone correct me if I'm wrong, but I think it's like PDUFA 7. Okay. Yeah, we're on PDUFA 7 or 8. Those have been used as vehicles for other healthcare policy writers and other things at FDA. So we'll continue to see what that looks like. I've heard folks propose some, talk about psychedelic carve-outs or things like that in the next PDUFA. I don't really know how effective that would be or what that would look like. But I think it's kind of hard to project on PDUFA now, especially if RFK Jr. is confirmed, which isn't necessarily a sure thing. They really want to re-examine PDUFA in the way that the FDA is not only funded but staffed and what the role of the FDA really is. So kind of a harder question to answer based on the election results.
Thank you. I appreciate it.
Yeah.
privilege here for a minute. And not only do I want to thank you, but I want to talk a little bit about why we invited you and why we're talking about that. For those of you who are regular attendees at our RPC policy meetings, we've looked at different psychedelic therapies over the years. And the reason we've looked at it is that we know that folks are going out and they're using things on the streets. And we're really worried about that. We're worried about overdose. We're worried about tainting. We're worried about the fact that in recent decades, that research kind of came to a halt, but now it's starting up again. So we're really excited to see research because we want to see evidence-based. We want to see what people want because Mental Health America is all about choice and choice of what people with lived experience want. And we know they're going out and they're looking for these things. So we've been working with the FDA to help the FDA look at things in an unbiased scientific way. I've been known to yell at them and tell them to move their prejudices out of the way and to stop being disparaging of people who have suffered trauma and people who are looking for help. So we're so happy that Charlie came here today to help us look at some of the things in the states. And as I said, over the years, we've been looking at some of the research. We'll continue to look at it. The jury's still out on all kinds of things, but we really want answers. So we're very, very grateful. And I appreciate you all sitting still for a really long time. We're going to thank Charlie in a second, and then we're going to take a break for 15 minutes. And as usual, we have some more amazing things, and we're going to really hear the voices of lived experience. We're going to start with that after our break. We'll be able to chat with each other through lunch, and then we're going to hear more about fabulous things in the States and what we can do. So please join me in thanking Charlie.